This is Chapter 16, which is the treatment of psychological disorders. In Chapter 15, we talked about a few of the major classes of psychological disorders. So this chapter goes over some basic ways of how to treat those disorders, because as we know, those disorders, one side effect is they create severe stress. So we definitely want to try and relieve that stress in a person's life. There are 5 types of treatment that we'll go over. The first is biomedical treatment, psychological, technology-based, combined, and then emerging types of treatment, new types of treatment that are really just being researched and thought about. Biomedical treatments is essentially primarily drug therapy, which would be, of course, the use of medication to treat disorders. A lot of us know about a lot of psychiatric medications. There are mood stabilizers, antidepressants, anti-anxiety, and antipsychotic drugs, and also stimulants and cognitive enhancement drugs, which that would be like for ADHD, like your Ritalin and Adderall would include those. Electric and magnetic therapies are also biomedical treatments. Electroconvulsive therapy, which in the past was used very inappropriately, but today is used as a treatment of last resort for severe depression that involves passing an electric current through a person's brain in order to produce a seizure. Repetitive transcranial magnetic stimulation, or RTMS, is a treatment for severe depression involving the exposure of specific brain structures to bursts of high-intensity magnetic fields as opposed to electricity. And deep brain stimulation entails implanting electrodes into the brain to allow for electrical stimulation of specific brain regions and clusters of neurons. I know these therapies sound really scary, so keep in mind that these are last resort treatments for really severe depression. These are definitely not something that you would go to first to try and treat depression. So those are the biomedical treatments. Let's look at psychological treatments now. The most common thing we think of with psychodynamic therapy is the person laying on the couch, as in the picture with the therapist in the background, and it's based on the theories of Sigmund Freud. He made the assumption that any current behavioral, emotional, and/or cognitive issues are based on childhood experience and internal conflicts. So there we see again that relationship between behavior and feelings and thoughts. So traditional psychoanalysis aims to provide insight regarding the root of the client's concern through evaluating those thoughts, feelings, and behaviors. And the client is encouraged to discuss anything that comes to mind. And psychotherapy is usually a very long-term venture. You create a relationship with the therapist and go for long-term treatment. There's also humanistic therapy, which tends to focus more on the client's current experiences than their past. As I just mentioned, Freud really focused on childhood experiences and how those affect us currently. But humanistic focuses more on our current experiences. It's a very client-centered therapy, which means you have unconditional positive regard, positive respect for the client and their position. You have empathy, you're non-judgmental. You recognize that the client has their own point of view of their life and experiences, and you're very genuine. You're very open and honest with the client. So that's all humanistic therapy. Behavior therapy specifically focus on changing behaviors. Instead of thoughts, feelings, and motives, they look at changing behaviors. For example, systematic desensitization is a fear reduction method that consists of gradually introducing the feared stimulus to the client. So if a person is afraid of snakes, perhaps, just for a simple example, you might gradually introduce snakes to the person. First, you might introduce it virtually, and then the person can build up to being in person. So you focus on that behavior. Cognitive therapies, on the other hand, focus on the changing maladaptive or negative patterns of thinking. Cognitive behavioral therapies, of course, focus on the relationship between the thoughts and the behavior, trying to change those. Group therapy. Group therapy is essentially the same as individual therapy, except you're in a group of people with similar concerns. The goals are supporting each other. You develop social skills by talking to other people in the group, and you're able to hold each other accountable. If you say you're going to do something, your group members can hold you accountable for that. So group therapy is a great tool also. Technology-based treatments, these are really popular these days. Um, Virtual reality therapy and live online therapy. I see so many ads for this and so many companies that do this where you can just pull up your therapist on the computer and have a relationship with that person and do therapy. So it's a great thing. But those are technology-based treatments. Combined treatments, which obviously would be combining some of those we've already discussed. You can combine medication and psychotherapy. That's probably the best treatment for most things is the combination of drugs and therapy. Um, Integrative therapy is therapy in which the therapist draws from different approaches. For example, they may use drug therapy and behavioral therapy, or drug therapy and cognitive therapy, and they do it to fit what the client needs. Mindfulness training and psychotherapy. In mindfulness training, the client or the meditator is trained to calm his or her body and mind and to notice the thoughts or feelings that might draw his or her attention without getting pulled around by them or clinging to them. So it's simply just a combination of learning how to meditate and be present with your body and also psychotherapy. Emerging treatments, again, treatments that are probably just thought of recently and being researched now that we don't really use yet. Genetic therapies, which involves manipulating the genes that cause a disorder, and psychedelic medicine, which is the controlled use of psychedelic drugs for treatment of physical and mental disorders. And I just included a note there in case you aren't real sure what psychedelics are. That's a subclass of hallucinogenic drugs whose primary effect is to trigger non-ordinary mental states and an apparent expansion of consciousness. Some examples of that would be MDMA and LSD. And when psychedelic medicine is used to treat psychological disorders, it's legal, and it's by no means used in the same way as it is when it's used illegally. It's used very carefully and in a very controlled environment. But they found that these things might be helpful for psychological disorders. Those are the basics of treatments, classes of treatments for different psychological disorders. If you have questions, please let me know, or feel free to look at your textbook for more detail on each of those types of treatment.